Good day, everyone. I'm Yimang from Institute for Public Health. The title of my manuscript is Vision and Hearing Impairments Affecting Activities of Daily Living Among Malaysian Older Adults by Gender. I'll start with introduction. Vision and hearing impairments are common and prevalent among older adults. Globally, there are approximately 185 million people aged 50 and above visually impaired. WHO estimates that approximately one-third of people above 65 affected by disabling hearing loss in a 42 population-based studies. Similarly, in Selangor state of Malaysia, it was reported that 76% of older adults had hearing impairment and 27% of older adults had vision impairment. Both vision and hearing impairments can cause undesirable health outcomes on physical and mental health, quality of life, cognitive function, including reduced functional disability. To date, there are limited studies from low and middle income countries exploring gender differences in the association between vision and hearing impairments and ADL disability. Therefore, this study aimed to investigate gender differences in the association between vision and hearing impairments and ADL disability among older adults in Malaysia. Next, I'll talk about the methodology. Cross-sectional data from 3,977 respondents aged 60 and above from NHMS 2018 were used. Logistic regression analysis was used to measure the associations between vision and hearing impairments with ADL disability, adjusted for covariates. First, the results from unadjusted model, which is model 1, vision and hearing impairment versus ADL disability, were reported, followed by results from a set of hierarchical models adjusting for the covariates, as shown below. As we can see, model 1 will be the unadjusted model. Model 2 will be model 1 with the inclusion of social-demographic covariates. Model 3 will be model 2 with the inclusion of health-related covariates. And model 4, the final model, will be model 3 with the inclusion of social-related covariates. So this slide shows the results of the analysis. The prevalence of ADL disability was found to be higher among female, 21% versus male, 12.7%, with significant p-value. Both male and female had similar prevalence of vision and hearing impairments. Table 1 shows the association between vision impairment and ADL disability. Among male respondents, the unadjusted odds ratio was 7.35. After adjusted for social demographic covariates, health-related covariates, and also social-related covariates, the odds ratio has reduced to 3.79. Similarly, among female respondents, the unadjusted odds ratio was 4.13. After adjusted for all the covariates, it has reduced to 2.66. Whereas for table 2, shows the association between hearing impairment and ADL disability. Among male respondents, the unadjusted odds ratio was 7.97. After adjusted for all the covariates, it has reduced to 5.76. Among female respondents, the unadjusted odds ratio was 4.57, and after adjusted for all the covariates, it has reduced to 3.3. So this will be the last part of my presentation, talking about the discussion and conclusion. So this study found higher prevalence of ADL disability among female respondents. One of the possible contributing factors could be the morbidity-mortality paradox. This paradox describes that female respondents experience more medical conditions and illnesses compared to male counterparts over their lifespan, although they have lower mortality rates. So in this study, vision impairment was significantly associated with ADL disability in both gender, and this finding is in line with previous studies. This study also reported that hearing impairment has significant associations with ADL disability in both gender. However, there were contradicting findings found in previous studies, and the inconsistency of findings could be due to different methods used in collecting hearing impairment data. Previous studies assessed hearing impairment using an objective method of a standardized protocol with handheld odometer. In contrast, this study measured self-reported hearing impairment. So in conclusion, both vision and hearing impairments were significantly associated with ADL disability with no gender differences identified. Therefore, early detection and effective management of vision and hearing impairments are important to prevent ADL disability and improve older adults' level of independence. With that, thank you.